بسم الله الرحمن الرحيم. بسم الله والصلاة والسلام على رسول الله. This is my first video in my new channel for anesthesia exam preparation course. I have a previous channel on the YouTube which was concerned with critical care, ultrasound and echocardiography. If you want to follow that, I will put the link down also. This video is just an introductory video about how to prepare for some oral and written anesthesia exams. I'll try to make sometimes it's generally speaking, and I'll try to make it sometimes specific to certain exams. The first concern I need to declare here that I have no conflict of interest, so any material I mention here or any source I have no relation to. The first concept here before you prepare for any exam, pray, and pray. It's to great extent a matter of luck, so you can prepare very well and you don't get the exam, and that happened with me once in my life. Second concept is the examiner is not your friend, the examiner is not your foe. He is not with or against you, he is just judging you. So keep that always in your mind. Definition is always a key. So you should show that you're understanding what you say. For example, I'll give you anemia. If you're talking about anemia and the patient hemoglobin is 13.2 and he is a male, so you're talking wrong. He will ask you immediately, so what is anemia? So you can say, you can define anemia in two different ways. Anemia is hemoglobin below 13. Or you can say, according to WHO classification, anemia is below 13 in male and below 12 in non-pregnant females and below 11 in pregnant females. What do you think? Which one is more impressive? That's just an example. Classify or die. Classify means talk broadly, then go narrow. So if I ask you, this patient has anemia, what do you think the underlying cause of anemia in this patient? You can go direct and say, okay, this patient has a chronic renal failure, this could be a chronic anemia of chronic disease. You may say it like that. Or you can say, this patient may have multiple reasons. I can classify these reasons according to microcytic, macrocytic, or normocytic anemias. Or I can classify that according to the cause of the anemia, the underlying cause of the anemia. So it could be production or hemolysis or whatever the cause. So you can classify according to that, then proceed to the underlying cause. Keeping in your mind that time is short, so you have to talk very briefly, but not fast. Try to make it an attitude for you to think before you answer. So with each question you are asked, just give yourself 3 seconds brief period. Try to make that as a habit. Think, classify, and then answer. Talk slowly, confidently, but not monotonous. Sometimes probing means the examiner is trying to guide you somewhere. Be smart. Probing is not always good. Sometimes he asks you aiming to trap you, and sometimes he's trying to help you really. How to judge that? It is just a matter of experience, trials. If you're doing an oral exam, try to avoid the traits. Traits means I put my hand here, I scratch my hair, I hold the pencil or the pen in my hand and try to do something with it, swinging my leg. Try to avoid that. It gives the impression to the examiner that you are under massive pressure or tension, which is not good. Try to be confident and avoid the traits. How that comes? It's just with training. Okay, the next point. There's always gray scenario. There's always something that tolerates general anesthesia or spinal anesthesia, for example. Take one of them. Don't give him the choices. So don't tell him that I can do that as general, or even I can do that with a spinal. That means for them that you don't know what to do. He will not think in it like, yeah, this guy knows all the options. No. If you want to say it one way and give your rationale to omit the other way. For example, okay, this patient has some sort of bleeding tendency, so it's better for him to be under general anesthesia to avoid the epidural hematoma with the spinal anesthesia. So you can rephrase what you want in the term. You deliver the message for him that you know that there is two options, but you're giving him your choice first. Basic topics are really fatal. If you don't know what's anemia, what's the definition of anemia, what are the classifications of anemia, that's really fatal. Even if you behave well later on, he will be hesitant to pass you because you did a basic topic issue. So try to know the basics again. Basics in anesthesia exams are definitions, classifications, chest x-rays, ECGs, echoes sometimes, CTs in the basic knowledge of it, and arterial blood gases, plus pulmonary function testing, how to read and analyze. That's really basic topics you should know well. I will leave some links for certain videos that I learned a lot from them. Please follow, and if you have any questions, please let me know. Basic pharmacology. Most of the exams in oral and OSCE, there is some medications the patient is receiving in his history. So when you dig in this, you will find an exam question asking you what antiplatelets this patient is receiving. So you will count 1, 2, or 3. So if you miss one of them, that's a negative mark. That means you don't know that this is antiplatelet. What anti-diabetic drugs this patient is receiving? So you should know what are the anti-diabetic drugs. Usually it is not in the main anesthetic drugs, it is in the adjuvants, antiplatelets, antiepileptics, diabetics, antihypertensive drugs, and he will ask you about these medications. And sometimes you go beyond that and ask what are the main side effects of each of these drugs, and sometimes what are the class of this drug. So for example, if the patient is on anti-diabetic drugs, he will ask you what class is this one and what is the major side effect of it. Okay, so that's the main pharmacology you need to know about. Again, in preparation for your exam, you have to be smart. Sometimes there is new issues coming recently, and I was always doing some guesses about the exam which most of the time worked. Like sepsis 3 definition. If it appears before the exam with 1 or 2 weeks, that may come and show you in your exam. If there is a new medications that cause a major side effect or withdrawn from the market, like activated protein C was withdrawn from the market in sepsis management, you will be asked about that also. So try to be smart. For example, there was an ambulance broke down and got a fire in the last few months here in Ireland, and it was an exam question. How you check your ambulance for safety. Be smart, be vigilant. I could recommend for you not to study alone, because if you are preparing for an oral exam and you read and read and read and read, then you try to rehearse after that and you are alone, you will never know your mistakes unless you record videos for yourself. How to do that? Do it in group study, and I have two previous experiences in this topic. I had done two groups. I was the leader of the last one, or the manager of the last one, and thank God all of them passed. It's not my effort, it's a group effort. So how to do the group? There's many softwares in the market, like you may use WhatsApp, you may use walkie-talkie programs like Zillow. I put a hint before on the Facebook in شبكة أطباء التخدير group to prescribe how it works. You may use these groups for group chat. One will ask the question, it will be timed, there will be an answer model, and after you finish, he will do debriefing for you. That's the real exam way. So if you do that, that's a positive reinforcement for you to study and study, and then you will find your weak points and work on it. If you're preparing for an exam and you're driving to your hospital 15 minutes, or you are walking to the hospital 15 to 20 minutes every day, keep the podcasts on your phone, in your car, and keep the flashcards in your pocket. Flashcards is just pieces of papers you created yourself for the topics you find it hard. So if you're going to the hospital, listen to some podcast, and then while you're coming back, listen again to the same podcast. So you listen to that twice in the same day, and in between you wrote some notes or reminders, so it will come as a refreshing material. If you do that like 2-3 times for a certain topic, believe me, you will find it easier to rehearse it. Then we'll come to the rehearsing point. That means use the resident or your colleagues with you in theater to rehearse what you learned today. Believe me, it's very good and will help you much. By the way, rehearsing means you will repeat what you learned to other colleagues. Always in each of us there is weak points. There is nobody weak point free. So your weak point could be the science itself, and many times it will not be related to the science. Maybe it's your tone of voice, maybe it's your attitude. So try to pick what are your weak points and work on it. Improve. It will just come with practice. As they say, fake it till you make it. When you are asked in a long case scenario like fellowship exams, FCAI, Irish Fellowship of Anesthesia, he will give you always 5 or 6 major diseases with the patient. For example, this patient has ischemic heart disease, chronic obstructive pulmonary disease, anemia, uncontrolled hypertension, and diabetes, obstructive sleep apnea. He will not ask you in the exam, mostly he will not ask you about all of these. 3 or 4 problems are the main issues he will ask about, and 2 are real distractors, because he doesn't want you to be ready with your questions, with your answers for all the questions. So try to pick 3 or 4 and write down the classifications and definitions and your answer in the paper before you go in. Keeping in your mind it is just 10 minutes. So divide your time to put the main problems in 2 minutes. Then classification, definitions. For example, whenever there is an obese patient in your paper, he will ask you what is obesity. So if you write in the piece of paper just in front of you, below 18.5 it's malnourished, 18.5 to 25 is normal, 25 to 30 is overweight, 30 to 35 is obese, and classify obesity 1, 2, and 3. So Whenever you are inside the exam room and he asks you this question, you'll just read it from your paper because you know that he will ask you these questions. Believe me, there is fixed type of questions in all the exams, like obesity, anemia, thrombocytopenia. There is many questions like that. So whenever you find something like that, put the underlying cause in your paper, but just in 1 minute. What are the resources you may use I'll focus on the fellowship exam because I freshly passed this exam. You can use structured oral board review exam book. You may use Viva Clinical book. This is the most two precious books, and recently released in the market the Master Pass exam book, which is really nice. In the end of it, you will find all the most recent studies that you need to pick and read carefully and keep in your mind. So if he's asking you why this patient is on beta blocker, you may say it can decrease the heart rate and decrease oxygen demand supply mismatch and go on physiological basis. But better than this, you may tell him, according to POISE trial, it showed improved mortality in cardiac patients. If he asks you, okay, if this patient is not on beta blockers, will you start it now? You'll say no, because according again to POISE trial, that was on the expense of cerebrovascular strokes. So, how you know about POISE trial? It may be randomly positioned in certain books, but in the Master Pass book, it's all collected in the back of the book. At the end of the book, you will find a chapter for the recent trial. POISE trial, nice glucose trial, etc. etc. Now, I finished my first video in exam preparation course. I'll go in series to discuss certain topics, which I will rank these topics by importance. So I will start by anemia, obesity, chronic obstructive pulmonary disease, hypertension, myocardial ischemia, and then we'll go after that to the less important topics. Some surgical points will come and we'll discuss it on time. Thanks for watching this video, and I wish you subscribe to this channel just for hope that we'll put our hands together and get good progress over our career. Thanks very much.